to go ahead and get started. Thanks for being so patient. Good afternoon, everyone. I'm Steve Vieira, Assistant City Manager with the City of Corpus Christi. I want to thank you all for joining us this afternoon. It's important to know that as long as people want to get the vaccine, we make sure that it's readily available for anyone eligible. When it comes to our COVID numbers as a community, this is where we are this week. Total vaccinations given as of November 16th are 171,013 doses administered. Over 5,315 doses are boosters, and over 800 pediatric doses since last Friday, so that's really good. When we talk about those who are eligible for the vaccine, only 55.1% of the eligible population is fully vaccinated. But remember, the eligible population has now expanded with the added age group of 5 and older. Fortunately, our 65 and older age group is at 78.2% fully vaccinated. Some of the vaccination clinics that are available, if you're looking to get your first, second, or booster vaccine, there are numerous clinics available to you and your family. La Palmera Mall continues to be the busiest clinic. It's located in the old Charming Charlie store, open during regular mall hours every single day of the week. We also have the Greenwood Senior Center, the Physicians West in front of the old Memorial Hospital, the County Courthouse, as well as City Hall here in the Rotunda where you can get your free vaccine. You can also receive your free vaccine at the former Nike store at the old outlets of Corpus Christi Bay and Robstown. If you would like to find the hours and further information on these locations, please go to cctexas.com and click the tab Upcoming COVID-19 Vaccination Clinics. Remember, if you're looking to get your second or booster vaccine, please bring your vaccination card if you have it. If you don't have your vaccination card, it's possible for the health district to look up your profile in the database, so please don't let this be a deterrent for you. Let's remind ourselves we are still in a pandemic and people are still affected by the COVID-19 virus every single day. Lastly, this will also be our last COVID briefing that we will hold this year, unless we start to see numbers rise again. We are entering the holiday season. We've seen our numbers decrease, so we won't be hosting any more briefings for now, but again, we will revisit this as needed. Also, please remember to wear your mask when appropriate and get vaccinated if you've not already done so. Thank you. And now we'll have a brief translation by Gabby Morrow, then Louis Wilmot from our health district will have more COVID numbers and information regarding pediatric vaccines.
Es importante saber que siempre que las personas quieran la vacuna, nos aseguraremos de que esté disponible para cualquier persona elegible. Las cifras de esta semana son las siguientes. El total de vacunas administradas hasta ayer es de 171,013 dosis. Más de 5,315 han sido de refuerzo y más de 800 dosis pediátricas desde el viernes pasado. Solo el 55.1% de la población elegible está completamente vacunada. Ese grupo se ha extendido a niños desde los 5 años. Afortunadamente, nuestro grupo de 65 años o más está 78.2% completamente vacunado. En cuanto a las clínicas de vacunación, si está buscando recibir su primera, segunda o vacuna de refuerzo, también existen varias clínicas disponibles. La clínica en el Centro Comercial La Palmera sigue siendo la más concurrida. El horario de servicio es el mismo del centro comercial. El Centro para Adultos Mayores Greenwood también está disponible. Physicians West, frente al antiguo Hospital Memorial, la Casa de Corte del Condado de Nueces, aquí mismo en el Ayuntamiento en la Rotonda, y la antigua tienda Nike en los outlets de Corpus Christi Bay en Robstown. Si desea conocer los horarios y más información sobre estos lugares, visite www.cctexas.com y haga clic en próximas clínicas de vacunación COVID-19. Recuerde, si está buscando recibir su segunda vacuna o de refuerzo, presente su tarjeta de vacunación. Esta también será la última reunión informativa de COVID que realizaremos, a menos de que veamos que las cifras comienzan a aumentar. Lo exhortamos en continuar utilizando su cubrebocas y a tomar la vacuna si aún no lo ha hecho.
Good evening. Luis Wilmot, Assistant Director of Public Health for Corpus Christi, Nueces County Public Health District. I want to give you an update quick on some COVID numbers. Next slide, please. These are our daily case counts of our COVID that we currently see in our area right now, averaging about 30 a day. Although we are on a significant decline. The summer peak of 2020, we had a peak of 9,905. This past summer peak of August 2021 was at almost 12,000. Now we're down to these numbers here. For the month of November, we're at 668, which again is also helping us see that trajectory downward. Next slide, please. We currently have 681 active cases in the area. We've had 1,282 deaths from COVID since the beginning of the pandemic. And we currently have over 65,000 folks recovered from COVID-19. Our hospitalizations, like I mentioned, are on a decrease, or on a decline. We're down to 28 hospitalized as of today. We had a peak of 444 in August. So again, this is a good sign that we are making some significant gains of fighting this virus. Next slide. Again, our ICU patients have also declined. We're down to 14. We were very high before, previous up to about 150 plus. Next. This is just a slide noting the amount of deaths. 1,282 of our community members have succumbed to the virus. That's one too many. This is the breakdown of the daily numbers. As you can see, we might average one or two in a day, or sometimes none. The 8 was a little bit of a backlog. In the summer peak of August 2020, we had 180 deaths. That was the peak of 2020. Our summer peak of this past summer, September 21, we also had 180 deaths. But I will remind you that we had 2,000 more cases in the area. So our efforts at the rapid infusion centers, our vaccination efforts, did show that we are helping this significantly impact how many people are getting sick, how many people are getting hospitalized, and how many people are succumbing to the deaths, succumbing to COVID-19. So we continue to encourage folks to get vaccinated. These are just some more information. Mr. C. Vieira already covered a lot of the vaccination numbers. I will note that the majority of our vaccines that we've given, the Public Health District has given, has been the Moderna vaccine. Folks who have finished their 2 doses 6 months or longer ago, they could come in for their boosters. So that's the main effort we're trying to hit now. We're at 127,000 Moderna vaccines were given. There's plenty of folks to come in for their boosters. The boosters that we have given is over 5,000, but we expect that number to climb. And we want to remind you that if you received a J&J vaccine, you are eligible to get a booster 2 months after your initial J&J vaccine. Of course, you got to be 18 years and older for that J&J vaccine. When it comes to Moderna and to Pfizer, you're waiting 6 months after the completion of your 2-shot series, and then you have to qualify. You can be 65 years and older. You can be 18 and older with other comorbidities or increased risk for significant COVID disease. You can be 18 and older who live in a long-term care facility, or you can be 18 and older who live or work in a high-risk area. As Mr. Vieira noted, here's our current vaccination rates. We used to just, the eligible population was just 12 years and above. We were at 61.8%. That number was climbing. We've kind of went back down because we started adding the 5-year-olds and up. Now we're at 55.1. So that's going to serve as a good baseline for us. We have already started giving some pediatric doses out there. The Public Health District has given over 800. So we expect that number to climb significantly as long as our partners also out there in the community are helping with the vaccinations. Again, these are just for complete purposes, the vaccination clinics that are available. Mr. Vieira outlined those. The other ones he did not outline were the off-site clinics. We do have the QSR Legacy Events Center. That's available on Mondays from 11 a.m. to 6 p.m. On Tuesdays and Thursdays, we have the Goodwill Clearance Store on Ayers from 11 to 6 as well. And on Wednesday, the Falas parking lot from 11 to 6. I'd like to let you also know that we are working with local ISDs to help make vaccine more readily available to their students. We have over 17 planned events at local area elementary schools so that the parents have easy access to get their child vaccinated if they choose to get vaccinated. We're going to report also that our state rapid infusion center at the Richard Borcher Fairgrounds will be ceasing operations after this Friday. They've done a lot of great work for us, treated over 2,200 folks, keeping people out of the hospital. We have seen a significant decline in our cases, so that's why they're kind of hanging up the shingle. You do have infusions still available in the city. There are some at local area hospitals, Hector P. Garcia Clinic, and there's also a mobile infusion clinic hotline. And there's the number right there, the 1-800-742-5990. You still have to qualify for this infusion. You must be 12 years and older. You must weigh at least 88 pounds. You must have a doctor's referral. And it must be 10 days since the symptom onset. And you must have a pulse oximetry level greater than 93% to get the medication. That concludes my briefing. We'll be followed by Dr. Bird's video.
El día de hoy se reportan 39 casos positivos por COVID, 668 durante el mes de noviembre. 681 casos aún se encuentran activos. 28 personas se encuentran en el hospital, 14 de ellas en la unidad de cuidados intensivos. A la fecha, 1,282 personas han fallecido. El día de hoy, un hombre en sus años 80. El total de vacunas administradas por farmacéutica son las siguientes: Johnson & Johnson, 8,235, Moderna, 127,380, Pfizer para adultos, 34,589, Pfizer pediátrica, 809, haciendo así un total de 171,013 vacunas. Las vacunas de refuerzo administradas por parte del Departamento de Salud han sido 5,315. El porcentaje de personas vacunadas mayores de 5 años se encuentra en el 55.1%, para mayores de 12 años 61.8% y para mayores de 65 años 78.2%. Estamos trabajando en 17 eventos que se planean para estudiantes para que todos tengan la oportunidad de recibir una vacuna. Esa información la vamos a dar a conocer una vez que tengamos todos esos detalles. Las clínicas de infusión rápida van a cerrar. El último día de operación es este viernes 19 de noviembre. Esto se debe a la reducción de número de pacientes. Esos servicios van a estar disponibles en hospitales y en otras clínicas móviles. Para más información, puede comunicarse al 1-800-742-5990. Para mayores de 18 años, para mayores de 12 años están disponibles estas transfusiones. También tienen que contar con más de 88 libras de peso y tener una referencia médica. Ahora vamos a ver el reporte del Dr. Chris Bird.
Good evening. My name is Dr. Chris Bird, and I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling Team. This is your COVID-19 pandemic report for November 17th, 2021. The purpose of our modeling team is to address your concerns and questions about COVID-19, as well as enable evidence-based decision-making. We start off each week showing you the calibration of our model in orange to the data in black. And the better the fit you see between those two, the better our model is expected to perform. You can see that we have a fairly tight fit between the orange and the black data points. And you can also glean from this, because it is indicating the number of cases or number of infections in the community, that cases have leveled off and maybe they're just slightly increasing, but not too much. Now, based upon this calibration, we can infer the transmission rate, which right now is 1.05. And what that means is that for every 100 people that contract COVID, they're passing it on to approximately 105 people. So that's very close to staying about the same, and it's certainly not increasing very quickly, if it's increasing at all. In terms of the number of people in the ICU with COVID, right now we have 18, and that number is dropping. Now, based upon the projection, we expect it to not drop too much more. We expect there to be a leveling off in the number of people in the ICU with COVID, and we expect to see that same leveling off in terms of people in the general hospital beds, in inpatients. Right now we have 46, and we expect that to level off. But you can see that there's been a precipitous decline from the summer. In terms of hospital capacity devoted to COVID inpatients, we're down to 5.4%. That's very good. If you remember in the past, this 15% threshold is what triggered business capacity to roll back. So this gives you some frame of reference with which to interpret the numbers, and right now we're well below that 15%, and we've been below that value for approximately a month now. In terms of vacancy, this is something that we've been watching very closely, and this is just the number of staffed beds in our hospitals in the Coastal Bend that are available to accept patients. Right now, 17% of the staffed beds are empty and ready to accept patients. And that's much better than we were right at the beginning of September, but still not nearly where we were back in the majority of the pandemic, mainly before the summer peak that we just went through. So the vacancy is improving in our local hospitals, and we hope that that will continue to improve. In terms of fatalities, the number of fatalities per day is declining. The projection indicates that we won't get all the way down to 0 fatalities per day, but we expect it's going to level off right around 1 or 2 fatalities per day from COVID moving forward. All right, I know that a big question that everybody has is what's going to happen this winter. Last winter, the state of Texas experienced a fairly formidable COVID wave with over 200 daily COVID cases per 100,000 at its peak. And then this summer, again, the state of Texas experienced another wave. Now, compared to the winter, for the whole state of Texas, the wave wasn't as big. But for us here in the Coastal Bend, it was much bigger this summer than it was in the winter. So that's something to keep in mind. And now as we come into the winter of 2021-2022, I know everybody's wondering what's going to happen. So right now, our best projection, and this is from the IHME model run by the University of Washington, is the premier COVID modeling outfit academically in the United States and possibly in the world. And right now, they're projecting a very, very mild bump for us. Now, these projections can change, and especially when you're projecting out several months, it's hard to know exactly what's going to happen 3 months from now. But this at least seems to be a good sign. If you're wondering what kind of effect masking has, if 95% of us were masking in public, we'd expect the number of COVID cases to go down to nearly 0 by the end of the winter. Now, I don't see any evidence that this is occurring, so this is just a scenario to show you what the modeling indicates would happen if everybody were masking in public. Now, on the other side of the coin, we can look at what happens if nobody's masking in public, whether you're vaccinated or not, and the transmission rate of COVID increases by about 2 times. And I would say that something like increasing the transmission rate 2 times with COVID, excuse me, would involve a new COVID variant. Now, that being said, I don't see evidence that there is a new COVID variant on our immediate horizon. I checked the data with the CDC this week, and in Texas, I believe there have been 100% of all of the COVID cases where they checked, people were infected with the Delta variant. And so there's not some other variant right now that's coming up behind Delta that's even more transmissive, at least here locally. And so this seems like a far-fetched sort of projection. Again, it's a worst-case scenario. Could we go through another peak? Yes, we could. But right now, the projection is that we will have a mild winter in the Coastal Bend when it comes to COVID and in the state of Texas overall. In summary, the new cases are continuing at the same rate for the past month, and hospitalizations and fatalities continue to decline, but we expect by the next time we're talking to you, we will see evidence that they've leveled off at some value above 0. Our recommendation to quell COVID are: 1, get vaccinated with the COVID vaccine. If you're already vaccinated and you're eligible, get the booster shot. If you're symptomatic, and I want to emphasize this, symptomatic means feeling any signs of being sick. You have a cough, you have a runny nose, you have sniffles, you have cold-like symptoms or flu-like symptoms. You don't know if you have COVID or not, and at that point, you want to self-isolate and you want to get tested. If you're positive for COVID, you want to immediately sign up for the monoclonal antibodies, and you can talk to your doctor about that. Now, in the Coastal Bend, we get these monoclonal antibodies for free, and they're demonstrated to reduce the chances that you'll end up in the hospital or worse from your COVID infection. And I want to point out that while they're free locally, most people in the United States have to pay a lot of money for these monoclonal antibodies. So this is really a great service that we have locally that's been arranged for us. Lastly, we still do encourage the masking up in public and social distancing. You saw in the projections that if everybody were to mask, that COVID would essentially go away. Now, that being said, it looks like a lot of people are not masking. And one thing that I hope everybody's considering is that it's also flu season. And even if you've been vaccinated for COVID, that doesn't mean that you're not susceptible to the flu. And you may also want to consider getting the flu shot. All right, that's our report for this week. We'll be back in 2 weeks to give you an update and maybe a more informed projection of what's going to happen this winter. But right now, we're looking at a mild winter. Thank you very much, and we'll see you in 2 weeks.
Pending your questions, this concludes our brief. Yes, sir. Sure, and that's per Dr. Bird's projections. As you can see, you know, we're on a good trajectory right now, and if people continue to do these safe practices, that has helped us. I think we'll be just fine. In the event that we do start seeing a significant increase, we will quickly turn this back on and inform the community so that we can take appropriate countermeasures. Yes, sir. What else? Thank you.